Hi everyone, I want to talk about hypertension. Do you know what is high blood pressure or hypertension? Have you heard around you that this person is suffering from high blood pressure? Have you thought how can you prevent of getting hypertension? Do you know what is the effect of hypertension on your body organ? Now, let's learn more about this insidious disease. Well, hypertension is medical term of high blood pressure. High blood pressure is when your blood pressure, the force of your blood pushing against the walls of your blood vessel, is constantly too high. In order to survive and function properly, your tissue and organs need oxygenated blood that your circulatory system carries throughout the body. When the heart beats, it creates pressure that push blood through a network of tube-shaped blood vessels, which include arteries, veins, and capillaries. This pressure is the result of two forces. The first force, systolic pressure, occurs as blood pumps out of the heart and into the arteries that are part of the circulatory system. The second force, diastolic pressure, is created as the heart rests between heartbeats. Okay, so do you know what are the hypertension risk factor is? Well, there are some factors which are contributing in developing high blood pressure. These factors are obesity, high alcohol intake, high sodium intake, dyslipidemia, which means high cholesterol level, sleep apnea, old age, and family history. The damage starts in your arteries and heart. The primary way that high blood pressure causes harm is by increasing the workload of the heart and blood vessels, making them work harder and less efficiently. Over time, the force and friction of high blood pressure damage the delicate tissue inside the arteries. In turn, LDL bad cholesterol forms plaque along tiny tears in the artery walls, significantly the start of atherosclerosis. The more plaque and damage increase, the narrowing the inside of arteries become raising blood pressure and starting a vicious circle the further harm your arteries, heart, and the rest of your body. This can ultimately lead to other conditions ranging from arrhythmia to heart attack and stroke. So, having long time high blood pressure will cause vascular changes. When vessels are under high blood pressure for time being, the small muscle in the vessel thickened. Also, the fat plaque built up inside vessel lumen, which both cause blood vessel narrowing, which lead to increased more pressure. Well, these vascular changes eventually cause end organ damage, which include stroke, occluding eye blood vessels, thickening of heart ventricle, cardiac failure, which means heart does not have enough power to push the blood to vessels due to vessel resistance and kidney dysfunction. So, how can we help ourselves? As we said so far, the effect of high blood pressure on different organs are very remarkable. So some of them, this effect is non-reversible. So it is very important to know how we can prevent of developing high blood pressure as much as possible. We have to be careful about what we eat, especially food containing salts such as canned food. Try to eat balanced diet, mostly rich in fiber and vegetable. Try to have exercise, at least 30-minute walk daily, 5 days a week. Limit our alcohol consumption and maintain healthy weight. Thank you so much for your attention.